Mary Rhodes from the Guam Hotel Restaurant Association onto the show. Good morning.
Hi, good morning.
Well, thanks for coming on. We wanted to bring you on because there's just so many things that are falling in the GHRA's wheelhouse, but we wanted to start specifically on the hotel quarantine and isolation facility procurement and the process that went down, because I know that you said you have some things to share on that, so go ahead.
Yeah, I know that GHRA has been mentioned several times, and I know that some of the documentation that they kept referring to was GHRA, and so I just want to let the community know that the Guam Hotel Restaurant Association actually serves in the RAC with Homeland Security and Office of Civil Defense during emergencies. We've been in this role for more than 20 years, and I personally have been in this role for 14 of those years. And at any time, any given time during an emergency, I heard the interview with the governor yesterday, Governor Calvo, and I think it's really important to note that, yes, anytime during an emergency when these emergency declarations are put out, all the agencies are working together at the emergency response at the center up in Adelut, so that we can, or at Gany Heights, so that we can work together to provide resources and also to collaborate and coordinate services during that time. And so GHRA was tapped by Homeland Security Advisor Tumagan, together with, at the time, Chief of Staff Tony Babauta, to put a call out to the membership of who would participate in a quarantine facility. So we did 2 call outs in February and then again in March. And that was the documentation that Hiking was referring to. And so I've provided those copies to everybody so that they are clear in the role that we were playing, is just really a call out to see who's interested in providing those services. That does not mean that it goes outside of the purview of procurement. I think it's still important that that the government entities still follow through whatever that process is, whether it's go through GSA or through the proper protocols in getting those contracts. I have to say, though, in the beginning, when we did put out the notification, I did have meetings with Homeland Security Advisor, the Chief of Staff, and Legal Counsel with only 2 of the 4 hotels that are contracted with the government. And that was to make the initial meetings happen. And those all took place at Homeland Security. We also had meetings with every hotel and also our tour agents and also the airport. We had industry stakeholder meetings at Homeland Security when all this started in March. And so we were really performing as a group in during that time when we were at Homeland Security, when the initial executive orders were taking place. So that was with executive orders 2020-05 as well as 04 for mandatory quarantine and isolation. And I know I conducted at least 2 interviews with you and Bree with regards to these services. And so all of that was handled through a call out to our membership. And those who responded, we provided the list of all those who responded no. So DOA administrator earlier, he had mentioned that, I don't think that the question is there is going to be a protest so much. I mean, if there is a procurement protest, then sure. But during this time of emergency, I know that the governor has those powers under Title 10, and the way it's supposed to work through Homeland Security is that they can actually avail of services and get resources through the different racks. But there are protocols at Homeland Security with regards to how those services are retained.
Sorry, Mary,
also all the paperwork.
Sorry, a RAC is a response activity coordinator, right?
Yes. Correct. Sorry. Yes. So we're a response activity coordinator. So whenever there's a question or a service needed, or let's say it's even water, right? Or meals for 50 people, we always send out those requests. And so those requests are sent out to people, and then we get responses of who wants to participate. There are different people within the different agencies who are in separate racks. And so I'm in the rack that oversees tourism together with the Guam Visitors Bureau. And then I'm also in the rack with the vocational organizations who are nonprofits for mass care. And so that's how this transpired, is in the need for temporary accommodations for mandatory quarantine. Mass care was needed to house travelers, residents, military in the time of an emergency during this mandatory quarantine. So that's why GHRA has actually participated at the request of the government of Guam on 3 areas. One is quarantine for the local government, but we only did the initial call out. We did not participate in the subsequent conversations on contracts, which I thought that they received several contracts already to review, and then throughout the last 7 to 8 weeks. And so I'm not sure if that has gone through the AG's office, but I know that they've gone through several edits. And so I just want to make sure that everybody understands that this has been kind of a fluid process. The second quarantine is, of course, with the U.S. Roosevelt.
Right, Mary, can we just, before you continue, I noticed that the governor's office and then also Director Byrne, they keep throwing out that we worked with GHRA, and I feel like they're saying that because maybe in their mind it adds a certain degree of legitimacy to the whole process. But from what you're saying, you only held their hand on the 2 hotels. Is it Days Inn and Wyndham Garden?
Yeah, Days Inn and Wyndham, correct.
So what about...
we provided them a list of all the other hotels who responded, which the rest of them all said no to quarantine. We did also engage Hotel Santa Fe and another hotel that actually did not agree on rates. And so that's why High is referring to 4 out of 5. They did meet with a 4th one before Pacific Star, and I was part of that process.
Well, you weren't involved with Pacific Star in any way, shape, or form?
Not initially, no. That happened after I started moving on to the Roosevelt. So I think that it's important to note that that process already started, and I gave them feedback on who responded to yes, and then we had some initial meetings to explain the services required. But just to make sure everybody also understands that while we were having these discussions, not just on terms, it was also how the hotels would be utilized. And all of the initial discussions were based on quarantine only for travelers to be staying. They were not intended to be isolation facilities, because we already had the skilled nursing facility for ISO and the hospital. And so we wanted to make sure that, those locations were never filled to capacity. And as you know, they continued to transfer them out during a period. And even I know that Dr. Shea has been talking about GMH hasn't been at capacity, and there are no COVID patients there, but also skilled nursing facility. So some of those, we did have some at the skilled nursing facility, but eventually they transferred over to Days Inn,
right,
which
Marion,
the original intent of Days Inn was actually for medical staff.
Okay, Mary, so sorry, because you're just putting so much out there. Going back to what you had said, so the hotels only agreed to be quarantine facilities for inbound travelers. They never agreed to be medical isolation facilities, correct?
Yes, and I believe that was what transpired, I believe, about 6 weeks ago when I got moved over to the Roosevelt, that they had changed the strategy. And I believe it was primarily because, to plan for the expected increase of what they felt was going to be the surge for COVID, and they needed to build capacity in order to ease pressure at the skilled nursing facility and our 2 hospitals. And so I think the intent was there to provide and build capacity, but we never got to those levels to contain the virus.
So how did that work, Mary, when you guys made an agreement, say, hey, we're just going to do the quarantine, and then did they go back and change the contract, or was there a negotiation to change the terms?
Was there a designation at the beginning for this quarantine for Days Inn and what was the other hotel? Wyndham Garden.
Yes.
Okay.
Initially, under good faith, when they entered into those terms, they entered it under good faith for the rate, which, by the way, is $75 with $25 for meals a day. So it's a package rate of $100 a day, but all inclusive of meals.
That was all
so
verbal. That was all verbal. Okay. And then,
Yeah.
and then it changed to in writing.
Isolation in writing. I believe they made the contracts change to quarantine/isolation.
They made the contracts change. Can you clarify that, Mary?
I believe that they changed it in the language with the contracts. Yeah.
And was that with the knowledge or the input from the hotels, or was it they just said, "Hey, guess what? You're now isolation facilities"?
The latter. Yes.
So they didn't tell the hotels that we're going to change you guys ice. That's interesting.
Yeah, I think that's why we need to be careful with the optics, right? That it's coming out like the hotels. We have to remember the hotels are providing a essential service during this time, just like any of the essential workers and the hospital staff and all of that. And there are different sides to every story, but at the same time, I think everybody entered this with the understanding that we would do everything to protect the industry employees to not have any contact. And so even Days in Wyndham, public health has been servicing those hotels. And so that model, I think, was working. And even though they made it change to isolation, I think the terms should have changed even with the rate, because there are more services to be provided and other concerns when you deal with isolation. And also whether or not the correct medical staff is there, and also equipment. So
who changed the? Sorry, Mary.
isolation-
Who changed the contracts, and when were the hotels made aware of the changes?
I actually don't know all of that. I've been trying to understand it by talking to the general managers. I know that that was all done in the process of getting their final contract. So they have received a couple of versions. So it's just unfortunate because they've been providing these services throughout. And I just want to make sure everybody understands that they too have also provided, outside of what they do on a daily basis, they've donated, they've given back to the community in many ways, but they also are waiting to be paid on good faith based on the terms originally that was set forth.
When you did the call outs and the initial stages of all of this, did Pac Star respond yes? They were interested in being a quarantine facility?
Not initially, no. That was after the fact, because not all the hotels respond at the same time. So at the time I provided the information to the to legal counsel and Homeland Security advisor and chief of staff, it was only, I believe, 10 hotels had responded out of 28. And so we had to make some personal calls because some hotels were going offline completely. And I think Pacific Star came online because they were still open, and they were able to clear out some of the people by just by ending services at that time, and they were going to become available. So some hotels were really considered. And just so you know, every time we looked at a new hotel, we always had Homeland Security, Office of Civil Defense, CDC, as well as Public Health, Guam Fire Department, Guam Police Department, the Chief of Staff, Legal Counsel, all go through and do the site assessment. Was not done with Chief of Staff and Legal, but it was done with all those agencies with the understanding that they would be assessed to serve as a quarantine facility. And we have followed this process not just with the government of Guam facilities, but also with the Roosevelt hotels that have served during this pandemic. So we've been pretty consistent in how we've gone about in identifying the hotels based on the minimum requirements, and then also the assessment of those hotels in order to be turned on as a quarantine facility with the approval of Public Health and CDC and Fire.
Mary, was there ever any discussion with the hotels to allow sleepovers for highly placed out-of-loop staffers? Was that part of the contract?
We never got into how because I think that's really up to the government of how they're going to provide those services. What we did discuss initially was Guam Army National Guard and Public Health, because that is exactly how the Roosevelt, what we're doing or what we've done is it's all either Guam Army National Guard, Police Department, Customs. They all provide the perimeter, and everything inside the hotel is completed by or handled by the military themselves. So they're government employees, and they're all corpsmen, medical staff, as well as security personnel and military branches who are servicing this. So when we first did this, it was with the idea that Public Health and National Guard would be providing these services. And that's how it's remained at Days Inn and Wyndham, I believe, and even Santa Fe.
Mm-hmm. So again, National Guard staffing these isolation/quarantine facilities in the initial.
For security perimeters, yes.
But in terms of like delivering food and towels
yes.
and
Initially, yes. We asked for Guam Army National Guard and also public health employees. And public health, they were actually at Days Inn and Wyndham the entire time. They had some other government officials, though, working, and so I'm not in charge of that. I know also I've spoken to Rebecca several times and thanked her for all the services because she worked closely even with Days Inn and Wyndham initially. And so I know that we were following those protocols at those hotels. But I have not been involved.
She knew that initially that there were talks of the National Guard staffing, not just perimeter, but staffing these quarantine facilities.
I don't know about that. I only worked with her after the fact, so I don't know how Public Health and CDC had set it up with Homeland Security and GPD.
But I mean, so at Days Inn and Wyndham Garden, because we got the list from Adelup, are there Adelup staffers, directors, deputy directors working at those two facilities?
I don't know.
Okay.
I only participated in the coordination,
right,
and I wouldn't even call them solicitation or procurement. It was really just coordination. I think in all my experiences, even with Homeland Security, there's still a process you go through, and whether that's through Chuck Esteves or Tim Muggan or the rest of Homeland Security. But, we have the former HSA guy there, Chuck Atta. He works with FEMA. They're all at Homeland Security. So I think that the biggest concern here is not so much who the hotels are and how they're getting or how much they're getting paid. It's really of how all of this has transpired, and whether or not the proper protocols were in place.
Well,
so were the proper protocols followed?
Bree and I are like, no, I'm gonna.
The same thing with DOA's director, Mr. Burns. I would argue that all contracts should be signed before services are rendered. If they're not, even in the case of the TR, we're finalizing our contract, but at every instance, I've received authorizations from the federal government to proceed on services on each time. So I still have some form of authorization from a contract officer for every service rendered and all the money spent. So there is still a feedback mechanism to ensure that proper protocols are in place so that there's no question when currently right now I'm reconciling. We have 9 out of hotels who have checked out, and so we're going through the cleaning, sanitization, and decon, and I'm still reconciling, the bill. So based on numbers, because you have to have daily accounting, daily records, not just timesheets and schedules, but even down to when food services were conducted, so you can account, and laundry was provided to make sure that the counts are completed on a daily basis so it matches up with what's going out versus coming in. None of the hotels, have these direct contracts with the vendors. These are all being procured separately, right? Whether it's a laundry vendor, unless they cook the food inside the hotel, some of these hotels have procured outside. And so there needs to be some reporting mechanisms in place and accounting for all of these things to be authorized, I would think.
So who would the who would the authorizations come from in this particular instance? Not in Theodore Roosevelt.
On the local side.
Yeah. Is it Esteves? Is it the chief of staff? Is it just the governor saying Wonder Twin Powers activate?
They're all working in concert with each other.
Mm-hmm.
Right?
But there has to be something in black and white. I mean, or just. I'm just trying to figure out. You said that there had to be some authorizations.
Yeah, I would think that through those services that have been identified as a need in the emergency declaration, that they would still have to work it through Homeland Security Office of Civil Defense in order that, so when the FEMA funding takes place for the reimbursement, all of their ducks are in a row for that reimbursement and nothing is questioned.
So, Mary, you're
So-
confident that all the ducks that you helped arrange with the Days Inn and the Wyndham, you're confident that for those, it's all in a row?
No, I've never seen an official contract. I only saw the initial template.
Okay.
So
So you
I'm
were-
not part of that process.
Right,
I
yeah.
only helped coordinate the call out and then the initial meetings to get them
yeah.
introduced to the Homeland Security Advisor, to Muggin, and to legal counsel.
Okay, so basically, if I could just paraphrase, what you're saying is, or what we're saying is, hey, Adelup has said GHRA was involved. We worked with GHRA, but you're saying, yeah, we started the conversation, did the call out, and sat some people down at the table. But other than that,
Well, we came up with the initial terms together with the hotels, and they were supposed to have matched what we proposed also for the Roosevelt, which is based on federal per diem rates. That's not what was finally negotiated. So I was part of those initial conversations, but I did not complete the process with contract negotiations because they needed to directly contract with the hotels.
is it pretty similar, the terms with the GovGuam hotels and the DoD side, like the cost and all that?
No. The federal contract with the Roosevelt is what we initially proposed with GovGuam, which is federal per diem rates. We do have a hybrid, though, because they are combining all of the services together to be a daily rate. So it is different, and we're hoping to. We have our copy of our definitized contract, and so I actually have a meeting with the GMs today to go over that. But it is it's handled in this initial manner in how it started, but the terms are quite different in the fact that the rates are different because they are based on federal per diem, which is approved by Congress, and also so that's how we didn't design the rates. The rates were submitted based on those federal per diem rates. And then also in the fact that we've had to include sanitization and decontamination services, biohazard removal, all of that. From what I understand, the government is paying for 15 days additional decontamination, which is similar, but they're going to handle the decontamination directly. And I know National Guard has done training on decontamination.
Right. Mary, I know that you had you talked about your experience with the EOC, so and I know you were listening. Just kind of looking at the way that some services outside of the hotels are, because I just want to bend your ear on this. With meals, invoices being sent to administration director, hey, pay this. Is this consistent with, in your experience, how these types of purchases are made during an emergency, with the consideration that later on we want to have them reimbursed by the feds in some way?
Yeah, I think it's still about proper protocols and documentation. So even if this all went through Homeland Security, Office of Civil Defense, they're the ones who basically handle those processes during an emergency. I'm not a government employee, so I don't know all the intricate details of procurement and during an emergency.
Sure.
But in my experience with Homeland Security, there are times when we have to, during an emergency, get food, water, shelter. We have to play all of these scenarios out, and also during an actual emergency, during typhoons or whatever, the Homeland Security Advisor can make those calls in the RAC and at the EOC together with the governor. And as Governor Calvo mentioned yesterday, all those meetings took place at Homeland Security, and everything is directed in that manner because you have all agencies present. And trust me, I was at Homeland Security for about 3 weeks at the beginning of all of this.
Right, I remember.
Before the Roosevelt happened. So, there were a lot of meetings that we had with different stakeholders, different public-private partners in order to get these services activated, to get cooperation on how do we transfer people from airport to hotel. So all of that was taking place. And so I don't think that anything really was wrong in that, because that's normally what happens during an emergency declaration.
But so just riddle me this with this meals thing, right? So in tracking the FOIAs, we had the governor's legal counsel say, hey, Charles Estevez, I got all these meals for all these people, and this is how many meals, this is where it's going to go to. the guy's going to be in touch. Pay the man. And then so we saw Charles Estevez respond by saying to the vendor, can you provide the contract or the invoice? And then it jumped to the governor sending a memorandum to Lester Carlson and Ed Byrne saying, hey, pay this guy. So it appears that, like what you said, when you involve GHS and OCD, they're used to doing things a certain way, probably more by the book. And then it goes from them asking for the proper documentation to the whole process being moved outside of GHS and OCD. So I guess that means they're not really worried about the federal reimbursement, maybe, in your experience, or?
I'm not sure. I think in any emergency, you always want to make sure everything passes muster. You know, you're ensuring that anything you can try to get reimbursed under FEMA during an emergency declaration should have the proper paperwork and documentation to seek that reimbursement. And
that should kind of be the guiding. I would think that everything we do should be guided by, hey, we should make sure that we get reimbursed for this.
Yeah, I don't have SA or any visibility on the meals. That I only know that they were only contracting for rooms together with meals, and it was a packaged rate.
Right. So this is just the separate meals for the other cabinet and whatnot.
Yeah, everything outside of that, outside of rooms, meals, and laundry for the occupants. Right. Everything we've negotiated, even on the federal side, has always been based on occupants.
Correct.
Right. Not people manning the hotels.
I'm sorry, so yes or no, do you feel that the proper protocols based on all your years of experience with the RAC were followed in the procurement of these quarantine, well, at the time you knew, quarantine facilities, laundry services, meals for out-of-loop staffers?
Well, to be fair, I wasn't present in any of those meetings or conversations thereafter, so it's unfair for me, other than the paper trail, what can support it. Mm-hmm. I'm not familiar with any of those conversations or meetings after the initial meeting.
Okay, so for the quarantine facilities, were the proper protocols followed?
In the fact that we set those up and did the site assessments, and they started transferring. Of course, everybody has hiccups in the beginning, but I think they made those work. I think that the challenges are that it also changed midway for them to go to an isolation, which I don't know why that was important, especially when we weren't meeting capacity at that point. So I think that's very important, because we have a lot of people who are going home to families, and it's very important that, Days In was supposed to be for the medical personnel initially, and I know that they identified that possibly for Santa Fe.
Right.
So
but actually, sorry, Mary, how, were you guys involved at all? Because we've been really tracking this now. I don't know what the deal was with Santa Fe, but it's my understanding that Perlis Court, which is a condominium area or whatever, I can't think of the word.
Yeah,
but they're providing housing for the medical staff. So were you involved with the acquisition of Perlis Court in any way?
No, the last hotel that I participated in was Santa Fe, and that was just to contact the owner, not even coordinate services. So anything after Pacific Star, Perlis Court, I was not involved in.
So
Pacific Star, I have to say, though, the only thing is I do talk to the GM regularly, and Perlis Court is not a member of GHRA, so I don't know where that came from. But on behalf of Pacific Star, they were offered the exact same terms with as Days Inn, Wyndham, and Santa Fe.
So when Days Inn was, because we spoke with somebody who was in quarantine at Days Inn, and he was just told suddenly, and everybody else that was there with him, suddenly they were told, get your stuff, and we're moving you over to Pac Star. There's no reason provided. It was just a sudden move. But at the time that they were there, were you saying that they weren't even at max capacity?
The reason why all of that was really important was, you guys have to remember that time frame and when that happened. That's when Duarte announced the closure of the airport in the Philippines. And so that's why Pacific Star needed to happen quickly. I was asked to look at probably 3 hotels, and just so you know, we also approved several other hotels to serve during, in addition, not just Pacific Star, but Leo Palace, Fiesta, and Hilton were also did a walkthrough for a site assessment to service quarantine facilities during that time. But that was only going to be activated if they were going to exceed the capacity.
Mm-hmm. And a part of this also is, if nobody knew where any of the quarantine facilities were at because nobody wanted to tell the public. So that's why we're trying to catch up on where and what hotels were used. But
well,
just,
I know I personally contributed to that because I didn't want to disclose the names. That was part of the agreement was, with brand standards and just the association and some of the stigma associated with it. But, this is a worldwide occurrence. Hotels are being used for transient populations and to quarantine travelers all across the world, especially the United States.
Hey, Mary.
So
You said transient. So I'm wondering, the whole homeless shelter plan. Has there anyone approached you guys about maybe housing homeless in any of the hotels in your inventory or anything?
A couple of senators reached out to me, as well as actually Troy Torres reached out to me regarding homeless individuals, especially the one that got stuck here on Guam from the Philippines.
Brad, yeah.
Right. So they did reach out to me, but I told them that those decisions are really GovGuam's. I'm not in charge of the hotel quarantine facilities, so I shared that with the government officials.
Okay.
But essentially the hotels, in order to have a contract there, they had to pay for the whole entire hotel. So that was really their decision to make on that. But, like I said, I also helped assess additional hotels to prepare in case we needed to bring more hotels online. And so the hotels we walked through, I never did a walkthrough of Pacific Star, but the hotels we walked through was Hilton, Leo Palace, and Fiesta. And so I did those walkthroughs with CDC, Public Health and Homeland Security, Fire, and Police Departments. But we never activated them because they still had people. And also, Outrigger. Outrigger and Fiesta were the only two hotels at the time that had quarantine floors. And so we had additional hotels to serve on quarantine floors only, but that's not under contract with the government of Guam. Those were for travelers or military who paid their quarantine directly, not the government of Guam.
I wanted to go back. You said because of all of your experience with emergencies and disasters here on Guam, Edward Byrne was saying how he received these invoices. He got the instruction, the guidance, the formal notice from the governor to, about her powers or superpowers, and this has to be paid. Is that how it works, that you can just have the governor say, in an emergency situation, I guess this is a different emergency than any other emergency we've ever had. So she has these extraordinary powers, right, to pay this out without contracts?
I'm never involved in that part of the process. All we do at the RAC with GDB or with the volunteer organizations is to get the services, and a lot of those times it's donated services, or to get people to work together, right, during an emergency. But I've never assisted in payments or even getting copies of invoices to get paid. That is not in my lane.
Right, yeah.
My lane is to help public-private partnerships in securing things during an emergency, and usually those are donated services.
Right, but for the quarantine facilities, though, like you said, Wyndham and Days Inn, you were part of the initial discussions, right? Was there, and it was all agreed to verbally?
Yes, but also followed up with emails. I believe that they already provided a copy of what a wholesale contract would look like, and so that they see what kind of terms they normally work with. So all of that was provided.
But nothing has to be signed. It's okay as long as it's verbal and there's this email exchange that we're looking at you, we want you, we're going to use you, and then all we have to do is send an invoice over and we can pay it out with nothing in a contract form.
Again, that's not my lane. Whenever we get those services coordinated, it's handed off to Homeland Security.
Right.
And they go through the proper agencies to get all of those services procured.
Yeah.
So GHRA and GVB has never done that, and we go out and get contracts. What we do is we just go out and get people to work together and provide these services, and then how all the protocol, all the contracts and things to support it afterwards is really a matter between the government and those entities.
But would you think that a contract would have to be in place for these companies to, or hotels or whoever, to be paid?
Well, there's two things from what I understand with contracting. One, yes, all services need to have at least a PO, if anything, at least a purchase order or
If
a
anything.
contract,
Mm-hmm.
right? But if not a PO or a contract, what they can do is actually they can pay out for those services based on that PO, because that's like a purchase or it's a promise to order it, right, to fulfill those services. But as far as the payment, again, I'm not responsible for any of that stuff.
But I
But
think
if you're
what's-
handling like the PR, right, for the TR, are you going to just send over an invoice? Or are you going to
No,
have
with
like
every
documents that say this is what
so
you need to pay for?
in order, so what I've done on the TR side with every invoice, we have a occupancy report on daily counts for ins and outs. So we have a daily accounting that's supported and verified through the contract officer. But more importantly, the contract officer gives me verbal authorizations prior to any services even being authorized to be rendered.
I think what's key here, Mary, is you keep saying that the process should go through Homeland Security and Civil Defense. I think that you've been very consistent in
I
saying
think
that
in an
they're
emergency
right, yeah,
situation, they
right.
can bypass GSA.
Right.
But yes, that's how definitely the Calvo and the Camacho administrations did it. As long as I've been at GHRA, in this administration, it was a little different. Although we were all at Homeland Security, I have to say though, in defense of this, Homeland Security was involved from the beginning. So
on your end,
whether
yeah.
Tim Muggin or Estevez, right? So they were involved. Now, where the break in that process was, I'm not sure.
Okay.
Maybe they didn't concur.
Yeah, it didn't concur. Inside joke, Mary. I'm going to send you all the emails I FOIA, because if you got time for light reading, I'm going to send them over to you.
Oh, yeah, I just need so much more work. Yeah.
No, this is like on the entertainment side.
Well, I have also the other thing I wanted to remind everybody is, these are all very different kinds of responses, and I know it mirrors what's happening in North America and around the world. In our pandemic plan, which I know is old, it's 10 years old, more than 10 years old. It's really the Dededo Sports Complex and the UOG Fieldhouse, which they looked at, even for the hotel to hospital concept, they looked at that. But just the cost in putting those buildings together. So I think using hotels to lodge makes sense, but it's unfortunate how much has come out regarding these accommodations, because really it should have just been a very simple process, and we are acting under, the guise of that this is during an emergency and they had to procure immediately. And the reason why they turned on Pacific Star so quickly was really because the Philippines had announced the closure of that market and no international flights going further. But as you recall, he also recalled that decision 3 days later on Saturday. So the decision to turn on a really big hotel was important in order to meet the need and also to plan for that surge. But I think the big question, it's not so much who's getting it and how the services are performed. It's really on how it happened.
Right.
And that the protocols, and still today, the paperwork is not there.
Yeah.
And I find it hard to believe that. I know, but I find it hard to believe that even on the AG's office side that they haven't seen a contract, because I know that there have been actually 4 contracts given.
Yeah, and I just asked them again yesterday, and they said, yeah, we still don't have a contract.
Well, maybe they don't have a final contract,
No.
but I know there have been several versions of a contract.
Right. Well, I can read between the lines, Mary, and I think you've again consistently said that the real question to ask is, were the proper procedures followed? And I know if you're asking that and saying that's the real question, then I think we're good. Yeah.
But again, under Homeland Security Office of Civil Defense, a lot of it is fluid, and especially with confusion.
They got to be involved, is what you're saying.
Yes, but the confusion in this is it's similar to what the Gov said yesterday. It's been treated like as a public health emergency, and we're missing the other half of this, which is the business aspect of it, right? Is with the economy and with the recovery and all of that. So, and I know we were supposed to get to that question, Chris. So I just want to make sure that everybody understands that this was handled differently, I think, because it was a public health emergency. Not trying to make excuses for the government in how it was handled, but because it is falling under a public health emergency, that maybe they felt just with their authorizations with public health, that was good enough, but they still have to follow through with Homeland Security if they're expecting to get reimbursed by FEMA.
Thank you. Okay, Mary, did you want to touch on the recovery? I mean, reopenings, people talking about tourism. So we put on our industry hat, and the estimates about tourism making a comeback. What are your estimates, and what's your appraisal of the situation?
Yeah, we have a coronavirus task force group within Guam Visitors Bureau, and GHRA is a member of that. And so we've looked at a couple of recovery plans for each of the key source markets, being Korea, Japan, Taiwan, and others. And so we get regular market information, both in market with the actual agents as well as on social media, of how these are tracking. I know that a lot of the countries are getting ready to open up, if not already with Korea, but definitely Japan, I think, is planning for end of the month. But, travelers are still going to be wary, and I don't think it's reasonable to expect really for us to have great summer months, or even I think the earliest we could probably see some real positive numbers is probably October. But so much has to be done between now and October, where we really have to engage with our key source markets, the airlines, the airport, all the business stakeholders to get them ready. GVB and GHRA, we worked together with Guam Chamber last week on a workshop, webinar. And so I gave a lot of recommendations on what businesses need to consider and also implement as they prepare to reopen. And so that's really where we need to be at, is getting those businesses ready, not just in this P-Core, but all the way through P-Core 4, so that we can start receiving our own island residents and making sure everybody is safe and practicing good hygiene and safe protocols. So that's imperative before we can really start promoting ourselves to the other market. But in the meantime, it's extremely important that we start those conversations with those key source markets and get the airlines in a meeting with airport and GVB.
That's right. So we're going to get our GVB director to
there's an opening over at
wait,
GVB.
we don't have a GVB director. Oh, God.
Hint, hint, Mary, there's an opening.
Yes, I understand.
I'll be your deputy.
There's a lot,
I know better than a disunited.
I think we spoke to Mary more about tourism than we have with the general manager, actually.
We never had Pilar on here.
I think that, we definitely, I was telling Chris, you guys definitely have to keep this, maybe just change the name Containing COVID to something just more about general industry, because you guys are doing a great job, and I hope that this program stays in place, because I think it's very good for the people. Everybody wants timely live information, and not everybody's in the car to listen to radio, so everybody has their phones and can watch online, and streaming media is the way to go. But back to tourism, I think it's very important that all those strategies are reviewed with the agents who are in those countries and start planning of when's the earliest we can open up. as long as we meet the conditions of what the governor has put out, but the businesses are really, truly ready. And that's a lot of heavy lifting, whether it's the new GVB president, GHRA's president, or whoever, all the industry stakeholders. The point is we have to start getting together to start talking about this to get businesses really starting to get back online. Because there's going to be trials and tribulations for a couple of months before people really get good at their protocols, right?
Mm-hmm.
For opening their doors. And so we need to reassure the rest of the world that when we say we're ready to start having travelers come in and we're not going to have any reinfections, the reality is we're going to have some. There's going to be a second or third wave, but maybe not large as a wave. I think that it's unrealistic to expect that we won't have more COVID. And just so everybody knows, even though I've been working at the command post and Homeland Security, I told Chris that I took my COVID test last week. So I'm in isolation for 2 weeks now because I actually I tested negative. So even if I've been in contact with people who are turning positive, I think it shows as an example that everybody who worked in these kinds of environments, if they remain negative during the whole process, we can have a healthy, a successful reopening of the market.
Are you at Days Inn or Wyndham?
No.
Mary, we got to run, but it's always great to get you
Yes,
on.
thanks, Mary.
I feel like we got to do a part 2. So
Anytime.
Maybe next week.
I know I asked you guys to give me a break while I've been managing the Roosevelt, but
Yeah, Bree was on me to get you on, so I was like, okay.
thanks, Bree.
Yes, Mary's
So I'm
good,
available
Yeah.
man.
now anytime.
Yeah, thank you, Mary.
Thanks, Mary.
Thank you guys.
Okay, wash your hands.
Stay safe. Yeah,
Wash
you
your
too.
wash your COVID negative hands.
Yes, thank you.
Okay, bye.
Bye.
All right, 9:17. We got to take
She's
a
one
break.
of the shining stars of COVID.
Yeah, she doesn't work for the administration.
I know, but she's one of.
Okay, you know, we talked about, I'm just going to jump in here before we go to commercial, right? We talked about, you know, who do you think would be on your Mount Rushmore of the containing COVID like guests. I just want to say in terms of like length of interview